Welcome to Northampton General Hospital Maternity Services. We believe that good maternity care is based on the relationship between you, your family, the midwifery team and, where necessary, a specialist doctor, an obstetrician. Our aim is to promote the health, safety and comfort of you and your baby throughout your pregnancy, your birth experience and following your baby's birth in hospital or in your home. We want your experience of pregnancy and birth to be a positive one. Midwives will care for you throughout your pregnancy, referring to doctors and other health professionals where necessary. We aim to support and involve you, your partner and family in decisions regarding where and how you prefer to give birth. Depending on your pregnancy and wishes, you can choose to deliver at home, in the Barratt Birth Centre or in the labour ward. Antenatal care. Most antenatal care is carried out in the community setting with your named community midwife. Specialist care is available if required by doctors and our maternity team. Your booking appointment will take place with your community midwife, where all aspects of your pregnancy and care will be discussed. We'll offer you the choice of antenatal care that suits you. As part of your care, we offer you a range of checks and tests, including ultrasound scans of your baby. If there are any complications and you need to be reviewed by a doctor during your pregnancy, we will ask you to come to the antenatal clinic or the maternity day unit at the hospital. Midwives and doctors will review any concerns and advise you on further appointments. To help you prepare for the birth of your baby and preparation for parenting, we offer a series of antenatal classes at a variety of venues near your home. At these sessions, you'll meet other expectant parents. You'll meet midwives and assistant practitioners at some of the sessions, others being led by specially trained children's centre staff. All are happy to answer your questions and offer advice and support. Please speak to your midwife to book your classes. Choosing where to give birth. We can offer you 3 choices to where to birth your baby. You can choose to give birth at home, supported by a midwife from our home birth team and in your own familiar surroundings. You can choose to give birth in the Barratt Birth Centre under the care of a midwife in a comfortable, homely setting. Or you can choose to give birth on our labour ward with the support of our full obstetric multidisciplinary team of doctors and midwives. An epidural service is available. We can help you choose the option that's right for you. The first step, as soon as you know you're pregnant, is to arrange to see one of our community midwives. Home birth. Have you ever thought of having your baby in the comfort of your own home? Are you usually fit and healthy? Have you been well in your pregnancy? The home birth team midwives are available to discuss this option with you. The Barratt Birth Centre. The Barratt Birth Centre is ideal for women who want to have an active birth led by a midwife. Here you'll find comfortable home-from-home rooms with ensuite bathrooms, kitchenettes and birthing pools. Beautifully designed to help you relax and put you at your ease. 3 of the rooms have a double pull-down bed where you can relax during and following the birth. The birth centre is a choice for women who are usually fit and healthy, have been well in their pregnancy, have no previous medical or obstetric problems, wish to use therapies such as water, nitrous oxide gas, Entonox, massage, music, low lighting and hypnobirthing to enhance the safe natural progression of labour. 3 rooms have birthing pools that you can use as you wish, either for a water birth or to make you comfortable during labour. Our aim is for you and your family to have a positive experience of childbirth that establishes a positive and enriching start to parenting. We provide holistic one-to-one care by experienced midwives who specialise in promoting normal, natural labour and birth. We also provide advice and support from midwives and maternity support workers for infant care, breastfeeding and feeding choice. The rooms have been designed to provide support in a calm environment that supports active and normal birth. This relaxing atmosphere will help you to feel comfortable and secure. Emergency equipment is available, but if complications arise, you can be transferred to the labour ward where you can receive care from the multidisciplinary team. The birth centre is located near to the labour ward to ensure that any transfer, if needed, can be done quickly and sensitively. The labour ward. There are 8 labour rooms, one of which has a birthing pool and ensuite toilet. When you give birth on our labour ward, you will have your own room. Shared shower rooms are available. You will be looked after primarily by a midwife, who will be able to call in doctors if necessary. There are 2 operating theatres on labour ward, which are used if you require a caesarean section or operative delivery and procedures. If the situation should arise, the neonatal unit is situated near the labour ward, where our specialist neonatal doctors called paediatricians and specialist neonatal nurses are based. After your birth. Congratulations! We'll make sure that you and your baby or babies are well and comfortable. If there's anything you need which we haven't thought of, then please ask. Babies love the closeness of skin-to-skin contact, which can be continued after the birth for as long as you wish. Unless there is a problem, we won't disturb this precious time. Most babies will feed during the first hour or so following a birth, and you'll be offered help with this while your baby is enjoying skin contact with you. A midwife will check your baby top to toe soon after the birth. There are 3 postnatal areas where you may be admitted following the birth of your baby, unless you choose to go home soon after the birth. The Maternity Observation Ward, Robert Watson Ward and Balmoral Ward. The Maternity Observation Ward is a 16-bedded ward that is close to the labour ward. It provides care for ladies who require extra monitoring and care or who've had an operation such as a caesarean section. The induction of labour suite is also situated on this ward. Robert Watson Ward is a 23-bedded ward with 5 single ensuite rooms. The majority of women are admitted to this ward following the birth of their baby. The ward also looks after antenatal women who need to stay in hospital for observation. Balmoral Ward is a 7-bedded ward situated next to the birth centre. This ward has 3 single ensuite rooms. Your ongoing care. Your ongoing care will be arranged with you. For example, if you've had your baby at home, your midwife will ensure that you have contact numbers for calling a midwife should you need one urgently. She will otherwise plan to visit you the next day. After a straightforward birth in hospital, most mothers can go home within a few hours, and we support and encourage this choice. You may be advised to stay in hospital for a few days after the birth of your baby. If so, please ask the doctors and midwives about your likely date for going home in order to make plans with your family. Midwives on the ward areas will provide you with your care, together with support from maternity support workers. Once you're at home, a community midwife will visit you, either at home or ask you to attend a postnatal clinic. On some days, a maternity assistant practitioner or a maternity support worker might visit you. What care will be provided? Whether you're in hospital or at home, our midwives and support staff will help you learn to respond to and look after you and your new baby. Once you go home, your midwife will stay in contact with you, as a minimum until your baby is 10 days old. Home visits will be arranged by the midwife in advance. You're likely to see your midwife 3 times. However, some women will need visiting for longer, and this will be arranged. Once at home, your midwife is there to answer any questions or queries you may have, and will make sure you know how to contact a member of the community midwifery team if needed. In preparation for discharge, your midwife will hand over you and your baby's care to a health visitor who will continue to offer help, support and advice on all issues relating to family health until your child starts school. You may have already met your health visitor before your baby is born. We hope you've enjoyed this virtual tour and found it helpful. Wherever you have your baby, at home, the birth centre or labour ward, you will be cared for by a supportive, friendly team at Northampton General Hospital's maternity services. If you require any further information, please do not hesitate to contact your midwife or community midwife office 0830 to 4 o'clock in the afternoon.